today's video, we are going to illustrate the carcinoid syndrome. Now, carcinoid syndrome is a rare syndrome that is caused and associated with carcinoid tumors. Now, what are carcinoid tumors? They are tumors that arise from the neuroendocrine cells, from the intestines, and from the lungs. Now, the endocrine cells or the neuroendocrine cells are these cells that are found in the epithelium of the lungs and the GI tract, and they are specialized in the production of hormones under the nervous regulation. And in the carcinoid syndrome, the characteristic hormone that is produced is the serotonin. Now, these tumors are usually benign, only 1/3 of it metastasizes, and they are usually a solitary mass, and only 1/3 of the cases present with multiple masses within the patient's gut. Now, the pathophysiology of the carcinoid syndrome is dependent on the production of serotonin and the metabolism of serotonin also. When the serotonin is produced from the intestines, it has to go to the portal circulation, then it will be metabolized from the liver to an inactivated product, the 5-HIAA, then it will be secreted from the body and it will be inactivated. Now, not all of the serotonin will be metabolized of the liver. Some of it will reach the circulation and it will promote its effect. Now, for the carcinoid syndrome to promote its effect, it has to bypass the liver, to bypass the serotonin metabolism of the liver, so that if the serotonin that was produced by these cells were not metabolized by the liver, we will have a more concentration of the serotonin in the circulation and we will have more effects. Now, how will we do that? Usually, the carcinoid syndrome metastasizes to the liver, and it can bypass the metabolism. Now, what are the effects of the serotonin? The serotonin can increase the gut motility and it will cause diarrhea. The serotonin can also activate the fibroblasts, especially in the heart and especially in the valves of the heart, and this will lead to a valvular heart disease that we are going to talk about in a minute, and it can lead to bronchoconstriction. Now, depending on that, what are the signs and symptoms of the carcinoid syndrome? As we said, it is all dependent in the production of serotonin, so that we will have diarrhea. Because the increase in gut motility, the asthmatic wheezing, it is due to the bronchoconstriction, the cutaneous flushing, it's due to the cutaneous blood vessels dilation, and this is achieved by serotonin. And you can notice right here, this lady have these specified or specialized color of her skin, and right-sided valvular heart disease, and this is due to the serotonin that can activate the fibroblast and lead to deposition of collagen in the valves of the heart. Now, notice that it is a right-sided valvular heart disease. We're gonna tell you why in a minute. And the last thing, now the right-sided valvular heart disease can present either by tricuspid regurgitation or pulmonary stenosis, and you have to understand that both of these conditions are right-sided and not left-sided, and we're gonna illustrate it in a minute. And we can have pellagra, which is vitamin B3 deficiency, and we will tell you why in a minute. Now, the question is why it is right-sided heart symptoms, why there is no left-sided heart symptoms. Now, this is because the serotonin in the systemic circulation will reach the right heart via the inferior vena cava and the superior vena cava, and then will it go to the pulmonary circulation, and it will ultimately reach the lungs. In the lungs, it will be metabolized in the lungs, so that the lungs have the enzyme, which is monoamine oxidase, which is essential for the metabolism and the inactivation for 5-HIAA for serotonin, and reducing the inactivated form 5-HIAA, so that it will reach the left heart inactivated or deactivated, so that the left heart will not be affected. Now, if we look just right here, from the systemic circulation from the inferior and superior vena cava, it will reach the right heart. From the right heart, it will reach the lungs. It will be inactivated in the lungs, and it will go back to the left heart inactivated and will not produce any effects. Now, why do we have a vitamin B3 deficiency? The tryptophan is an essential amino acid that is responsible of the production of both serotonin and vitamin B3, but only 1% of the tryptophan will form serotonin, and the majority of the tryptophan will be metabolized to vitamin B3. But in case of the production of a high amount of serotonin, as in this patients, most of the tryptophan will go and will be metabolized to serotonin, and we will have a decreased amount of tryptophan that will be metabolized to vitamin B3, which lead to vitamin B3 deficiency, and it is called pellagra. We're gonna talk illustrate pellagra in another module. Now, how to diagnose the carcinoid syndrome? We have what we call the octreoscan scan. Now, in the carcinoid tumor cells, we will have an increased amount of the somatostatin receptors, so that what we do is we will have an analog, a radio-labeled analog of somatostatin, and we will give it to the patient, and we can trace it to see if an increased concentration and uptake of this analog in specialized areas, and this will indicate a carcinoid tumor. And we will have an increased production or increased the degradation products of serotonin in the urine, and the plasma test will show decreased vitamin B3, and we will have increased neuroendocrine tumor markers such as the chromogranin and so on. Now, how to treat it? We have first to decrease the hormone production by somatostatin analogs. Now, somatostatin is an inhibitory molecule in the neuroendocrine cells, and as we told you in a minute, the neuroendocrine cells in case of tumor will have a very amount of somatostatin receptors, so that somatostatin analogs such as octreotide will be very helpful. And we have to avoid the emotional stress and alcohol, because both of them can increase the symptoms and flares of the disease, and a surgical resection would be also considered. This video was provided by Air Medical. If you like it, please like, subscribe, and see you in another module.